everyone, it's Scientist Kinde here. So, do you snore? If you're sleeping and you sound like this, or like that, it is probably because you have sleep apnea. You probably stop breathing as you sleep and you get tired during the day and you have to take a daytime nap. Yes, you probably need to get screened for sleep apnea for sure. Sleep apnea affects the ability to get a good restful sleep because you haven't even stayed deep in sleep and you're already tired even after you got some sleep. You go to the hospital, there are two questionnaires that they use to assess patients for the risk of sleep apnea. One is called the Epworth scale and the second is called the Stubborn 2. So if you are moderate to high risk, you probably need a sleep study. Some occupations like pilots, school bus driver who require screening due to the nature of their job. Please make sure you share this video, like and comment. Remember, sleep apnea that is not well managed can increase your risk of cardiac problem and can affect your overall health. So get screened today and I'll talk to you later.